Hello, I'm Dr. Terry Hess. Welcome to our patient education series. This video will teach you about toenail removals and how to take care of them afterwards. Within the offices of Foot and Ankle Surgical Associates, our physicians perform multiple different procedures that require complete or partial removal of a toenail. Whether the toenail be fungus, ingrown, or traumatically affected requiring removal, we strive to make this process as pain-free as possible and the healing time as little as possible.
It is crucial that patients follow the home care instructions provided in this educational video to decrease the pain they experience and ensure their healing time is as quick as possible. There are two main types of nail removals performed, partial and full nail removal, and two different techniques used, a permanent or non-permanent method. Usually, a nail will be removed completely for reasons that involve fungus or some type of trauma, and usually the nail will be removed in a non-permanent fashion so that we can give it a chance to grow back unaffected. If there's any signs that this may not occur, a chemical will be used to destroy the matrix or regenerating cells of the nail bed. This is a permanent removal, meaning the nail will not regrow. Partial nail removals are performed in cases of ingrown toenails or if there's a specific trauma or infection affecting only a small portion of the nail. In cases of ingrown nails, the procedure is a permanent technique requiring the use of a chemical to ensure the edge of the nail does not regrow and begin to infect again. Regardless of the procedure performed, the patient will be anesthetized by receiving injections of an anesthetic at the base of the infected toe. This can be tender, but usually well tolerated. The nail will be removed either partially or fully, and if it is to be permanent removal, the physician will apply a small amount of a chemical to the areas he wishes to destroy. The toe will then be dressed with a healing gel and bandage. The healing process will take 2 to 4 weeks, but the tenderness will usually subside within a couple days. The important part for a painless and effective healing period will be the home care. If the patient received a permanent removal, they will be discharged with instructions to purchase a special ointment at the front desk called Amerigel. It is an ointment that has specifically been engineered to treat burns and heal them. The chemical used causes a chemical burn and requires the use of Amerigel to ensure the healing is quick and effective. If the patient has received a non-permanent nail removal, they will require an antiseptic ointment to help keep infection away during the healing process. The patient is to soak their foot and affected toe in warm water and soap for 15 minutes a day. A shower may serve as this soak as long as water and soap are allowed to reach the area. Epsom salt should not be used as it may be painful to the open wound. The surgical site may look white and pink if the nail is removed in a non-permanent fashion, and drainage of clear fluid is normal as this is the body's healing process. For permanent removals, drainage of a yellow fluid is normal, and the area may look gray and pink. The reason for the appearance and drainage has to do with the effect of the chemical. A burn was initiated that killed the cells in the nail bed. These cells will need to slough off over the next couple weeks, so drainage is normal. The area will try to form a scab. It is imperative that during your 15-minute warm water and soap soaks, you gently massage the area, removing any scab that forms. If a scab is allowed to form, the dead cells will have no way to drain away, and this may cause an infection. After soaking, you may apply a small bit of Amerigel or antiseptic ointment. All you should need at this point is a band-aid to cover the area. You may want to take it easy on your toe for a couple days as it may be tender, but most people have expressed that aftercare is much less painful than before the procedure. Inspect the site each day when soaking your toe to ensure that there are no signs of infection. These include any drainage that is thick and white, yellow, or green. This is pus and means bacteria has infested the wound. Any redness is normal in the first toe, but if the redness increases and starts to move past that first toe joint, then you need to be seen and call our office immediately because this is a sign of infection. If you experience any fever, nausea, vomiting, or chills, these are also signs of infection, and you should call our office immediately. Continue your soaks and application of antiseptic and Amerigel and a Band-Aid until seen at your 2-week follow-up. If you have any questions or concerns, please feel free to call our offices at any time. We're here to help you.